Here at Riverview Aesthetic Surgery, we perform the latest techniques in thigh lift. These patients typically are dieting and exercising and working hard to be in the best shape that they can be in, but some stubborn areas of loose skin and fat in the thighs make them self-conscious and concerned about wearing shorts and limited in the types of clothes they can wear and frustrated about the results of their exercising. A thigh lift procedure can be life-changing in that it can eliminate the sagging skin, the excess fatty tissue, and the cellulite and lumpiness and dimples that are traditional with losing weight, with liposuction alone in patients who have loose skin. A thigh lift is a procedure where we hide the scar either in the groin crease or a vertical scar that can be hidden as well in the inner thigh. And we perform some liposuction, we remove extra skin, we keep the scar as hidden as possible, and tighten up the entire contour of the upper and lower inner or outer thigh, depending on what the patient needs. When a patient comes in interested in a thigh lift, we perform a full history and physical exam, try to understand the needs and the recovery times of the patient, find out their occupation and see what time off from work is available to them, and come up with an approach that best meets their needs. Thigh lifts typically require 3 to 4 weeks of recovery time, although patients can typically return to work after 2 to 3 weeks. There are drainage tubes involved, as well as compression garments to be worn for 2 months afterwards. Drainage tubes typically come out 2 weeks after the procedure, depending on the patient's needs. We keep the patients comfortable, prescribing pain medication, Valium, and antibiotics, and making sure that our nursing staff explains to the patient all the details of post-operative care, drain care, having family members present to assist with getting out of bed and achieving the best and most comfortable recovery possible. Thigh lift patients are very pleased with their results. They've been fighting the effects of cellulite, loose skin, and stubborn, hard to lose fat from their thighs, and the results can be dramatic and life-changing for these patients.